What if I told you we could narrow down, in childhood, the people who would go on to use more than half of outpatient appointments in adult mental health services, and more than half of inpatient bed days in adult psychiatric hospitals? Well, we can. New research shows they're in child and adolescent mental health services, or CAMHS. CAMHS is the specialist healthcare service for young people up to age 18 with neurodevelopmental and mental health problems. The most common diagnoses in CAMHS patients are neurodevelopmental conditions like ADHD and autism, followed by anxiety and depression. But what are the adult mental health outcomes for young people who have attended CAMHS? To date, we've had limited information on what happens to CAMHS patients when they grow up. Do most young people recover? Do their childhood mental health problems persist? Do they develop new mental health disorders? This study investigated the mental health outcomes of young people who attended CAMHS, followed from childhood to nearly age 30. By the end of their 20s, 52% of CAMHS patients had gone on to attend adult mental health services. Of all adult mental health service appointments for 18 to 30-year-olds, more than half were taken up by former CAMHS patients. What's more than half of all inpatient bed days in adult psychiatric hospitals were also taken up by former CAMHS patients. The most common adult mental health diagnoses amongst former CAMHS patients included depressive disorders, anxiety disorders, alcohol use disorders, personality disorders, and schizophrenia spectrum disorders. Looking at the mental health conditions that take up most clinical time in adult mental health services, schizophrenia, bipolar disorder, recurrent depression, and borderline personality, about half of each of these diagnoses occurred in individuals who had attended CAMHS. Overall, these findings show that severe mental illness trajectories are commonly captured early in life in CAMHS. That means opportunity to better understand trajectories from childhood to adulthood mental ill health, and opportunities to intervene in child and adolescent mental health services to prevent the development of many of the most severe and enduring chronic mental illnesses of adult life. That's why we need much more research focused on long-term outcomes for young people who attend CAMHS, and research on how to alter long-term mental health trajectories.